I really appreciate that. And Dr. Rue, Dr. DeFlitch, Dr. Higa, thank you all for joining us today in this announcement. And as always, Dr. Levine done tremendous work, and I appreciate everything that you're doing. But again, thank you for being here, and to everybody out there, thank you for joining us. First of all, let me just start saying, by now you've probably all heard that I tested positive for COVID-19. I announced that, I guess, yesterday. I actually tested positive on Tuesday at a routine test. All employees who are at the Pennsylvania Emergency Management Agency, which is where I hang out when I'm in Harrisburg, are tested every Tuesday, and my test came back positive. I'm in isolation at home. I'm following CDC guidelines, the Department of Health, Pennsylvania Department of Health guidelines. So that's why I am joining you, like all these others, remotely today. I'm feeling well. I'm continuing to perform all my duties, but I was tested positive on quarantine. My most recent test is negative, so I think I'm through this, and will stay in quarantine until I'm allowed to come out or test out of it. But I'm feeling fine, and I appreciate all the well wishes that I've gotten from everybody. But my test results are a reminder that even if you follow every precaution, which I have, there's no guarantee, as Dr. Higa said, there's no guarantee against getting COVID-19. Together now more than ever to protect one another and stay safe. I think Dr. DeFlitch is right. We're in a really unusual time here, but there is light at the end of the tunnel. It's not like back in March. We know more about it. We're more prepared than ever. But this is something that we've got to get through so that we can get back to life as we want it to be. This is so frustrating and so painful, but we can get there, and there is light at the end of the tunnel. The point is, right now, the problem we're all facing is that this virus continues to rage in Pennsylvania. And over the past several weeks, it's become clear that we need to take further mitigation actions to protect Pennsylvanians and stop the spread of COVID-19. We all hoped it would not come to this. I mean, that's the point. The current state of the surge in Pennsylvania, though, will not allow us to wait. We need to slow the spread right now in order to save lives. If we don't, we're going to be in big trouble. So today I'm announcing additional temporary COVID-19 protective mitigation measures in the Commonwealth. The measures go into effect on Saturday, December 12th at 12:01 a.m. Friday into Saturday, and they expired Monday, January 4th at 8 a.m. With these measures in place, I hope that we accomplish three goals. First, I want to stop the devastating spread of COVID-19. Second, I want to keep our hospitals and our healthcare workers from becoming overwhelmed. As Dr. DeFlitch said, we're now in the 9th or 10th month of this pandemic. People are really tired. We're all tired, but our healthcare workers, above all, are really, really tired, and we want to make sure that we keep them from being overwhelmed. The third thing is to help Pennsylvanians get through the holiday season and closer to a widely available vaccine. That is the light at the end of the tunnel, as safely as possible. This is a bridge to that better future that we all know we can get to in Pennsylvania. We know that COVID-19 thrives in places where people gather together. And therefore, these protective mitigation measures target high-risk environments and activities like those. And they aim to reduce the spread of this devastating virus. So here are the things that we're going to do starting Saturday. First, extracurricular activities at schools will be suspended, including tournaments and practices. Second, indoor gatherings and events will be limited to no more than 10 people. And outdoor gatherings and events will be limited to no more than 50 people. Third, indoor dining for this 3-week period will be suspended. Takeout delivery and outdoor dining operations remain in place, and to support our restaurant industry, please do all you can to order online. Fourth, indoor operations will be suspended for this 3-week period at theaters, at concert venues, museums, movies, the arcades, casinos, bowling alleys, private clubs, and all other similar entertainment, recreational, or social facilities. as will indoor operations at gyms and other fitness facilities. Fifth, in-person businesses that serve the public, like retail, may only operate at up to 50% occupancy. Now, I know this pandemic has been hard on businesses throughout the Commonwealth, and it has been crushing for restaurants and bars. Unfortunately, COVID-19, that virus, thrives in places where people gather together. It spreads most easily when people are spending time together, talking with each other, talking without masks on. And these are the same conditions that we find in restaurants and bars. This has been shown study after study. It's not the fault of the restaurant owner or the bar owner or their employees or their patrons. It's not their fault that COVID spreads easily in these conditions. It's just the nature of the disease. It's unfortunate. The vast majority of restaurant and bar owners have been responsible and highly conscientious throughout the entire pandemic. But this virus is insidious, and it's spreading too quickly right now to make gathering indoors a safe activity. As much as we'd like it to be otherwise, it isn't otherwise, especially when it's not possible to wear a mask. I don't know how you wear a mask when you drink something or eat something. Since I have repeatedly called on Congress to pass the Restaurants Act and direct COVID-19 relief funding to Pennsylvania's restaurant and bars industries. There's actually a good bill sitting in Washington that could do this, the Restaurant Act. But we need to make sure that these business owners and they deserve and that they need to weather this pandemic. And we need our federal leaders to step up and provide the support these businesses need. That's a fact. The measures I'm announcing today are intended to be temporary. Again, they go into effect on Saturday, day after tomorrow, December 12th, and will remain in effect until Monday, January 4th. It's 3 weeks. For the next 3 weeks, please, I ask all of my fellow Pennsylvanians to stand with me, united against COVID. I'm asking that we work together to turn the tide of this surge so that our communities can safely bridge the gap between where we stand today and when a vaccine is widely available. By working together to stop the spread over the next 3 weeks, we will be saving lives, but we have to do it together. Each of us has the power to make a difference in the lives of our fellow Pennsylvanians by taking small steps to reduce our own COVID transmission risk, our own footprint. We each have that power. We each have that agency. I strongly encourage Pennsylvanians to follow our stay-at-home advisory. I understand that there's perhaps nothing more important than human interaction, especially within families. You know, when you're not able to see members of your family, that is not a small thing. That's a big thing. But we need to stay safe. So before you leave home, ask yourself, do I really need to make this trip? Do I need to really leave? And if you have to, then think about how you can do it as safely as possible. Wear a mask. Keep your distance from others who don't live in your household. As Dr. Higa said, avoid poorly ventilated spaces and wash your hands frequently. The point is, the situation we're in right now is dire. It's worse than it was in the spring when we first took action to flatten the curve. With so many cases circulating in the community right now, the kinds of everyday activities or small gatherings that might have felt low risk in the summer are substantially much riskier today. But every time we do one of the little things that lets us be safer, we're working together for that brighter future. And it's going to get here sooner. A study recently published in the journal called Health Affairs demonstrates that a vaccine is going to be able to protect our communities better and faster if the virus is already under control when the vaccine arrives. That means the work we do now to slow the spread of COVID is not only crucial to keeping our fellow Pennsylvanians safe and healthy right now, it's going to help us all get back to normal as quickly as possible. And it means more Pennsylvanians will be alive to celebrate that brighter future that's coming. This year, we show our love for our families and friends by celebrating safely and protecting one another. Let's work together right now to stop the spread of this virus. Because when we wear our masks, when we stay safe at home, when we avoid gatherings, we actually save lives. We get our own lives and get our own lives a few steps closer to that normal that we all want to get to. When we do the small things that keep each other safe, we aren't just fighting against COVID-19, we're actually fighting for a safer world and for safer holidays next year. We're fighting for next year's birthday celebrations. We're fighting for next year's family gatherings, graduations, weddings, bar and bat mitzvahs, parties, dinners out. We're fighting for the safety to get our kids back into classrooms and visit our families. We're fighting for the special occasions and the everyday moments we're all missing so badly this year. Together, we're fighting for a world where our friends, our neighbors, and family members are alive and healthy to spend holidays with us next year and for many years to come. So let's do this together, Pennsylvania. Thank you. And now all of us will be happy to take questions.
Thank you very much, Governor Wolf. We're going to go to questions, and our first reporter is Tyler Pratt from WLVR. Tyler, you should be able to unmute and ask your question.
Good afternoon, Governor. I'm glad to see that you're doing well. I have a question for you with a follow-up. The first being, you've been able to ascertain who you've come into contact with and who's had to quarantine?
Yes, I have. Thank you for asking. Thank you for your well wishes. I appreciate that. Yeah, that's a great point. I had a long session, very easy session actually yesterday with someone in the Department of Health who called to follow up and do the contact tracing. Fortunately, I've been very responsible in terms of staying home whenever I could, teleworking, Harrisburg, go through all the checks and stay as isolated there as I possibly can throughout the day. So and I also have the app and use the app, so everybody, the few people I was in contact with were pinged and know that they need to quarantine. So as far as I know, everybody has been contacted and that has worked out the way it's supposed to work.
And as a follow-up to your mitigation orders, what would you say to businesses, particularly indoor restaurants, that have been preparing for months for this winter and buying supplies to deal with in-person dining now that they're closed? Will there be any support offered to them?
Well, as I said, financially, what I have been suggesting and arguing for and trying desperately to get since August is funding from the CARES Act money that we had here at the state, which is going for other purposes, and trying to engage the federal government to do more for the restaurant industry. Again, as I said, it is no fault of the restaurant owners or the bar owners that the virus really does well in those environments, or owners of gyms or those kinds of facilities. But that's the fact. So we can ignore that. Or we can do what you're suggesting, and that is do what we can to get financial support for the workers and the restaurant and bar owners who are suffering so disproportionately through this pandemic. None of us likes this situation, nobody. But it's what it is, and we need to figure out how we can best navigate our way through that, and that's why these targeted, limited mitigation efforts, I think, are important as we all wait for the holy grail out there, the vaccine.
Thank you, Governor. Thank you, Tyler. Next up, we have Liz Kilmer from WPXI. You should be able to unmute, Liz.
Hi, Governor. Thank you for taking my question. I think piggybacking off of my colleague, for small businesses, you talked a lot about restaurants. This is going to be so devastating. And, you know, this is the government putting people out of work right before the holidays. The federal judge ruled that the previous lockdown was unconstitutional. What can you say just regarding your belief that this is constitutional? Is this the only way? And what else, if anything, can be done to help these small business owners?
Well, first of all, it's not the government putting businesses at risk, it's the virus. I think let's keep in mind all of us are doing the best we can to fight this virus. And as everyone, Dr. Rue, we first talked to, and Dr. DeFlitch and Dr. Higo, we're all concerned that if we don't address this correctly right now, we are going to face even worse problems with the hospitals and our healthcare system that has to take care of us all. If they're not able to do that, that's going to be a bigger problem than anything else we could possibly imagine. So we're not targeting anybody, the virus is. And we're trying, as the government, working on behalf of the people of Pennsylvania, to try to figure out what's the best way we can act right now in a targeted, measured way, in a restricted way, to actually allow us to get to the point where we have the vaccines. The vaccines, as Dr. Levine can talk in more detail about this, but should be starting to be available next week, I hope. But it's going to be time before people get through the different. I think the first 2 rounds vaccines are going to take two shots. But what we need to do is get through the period right now. That's what I'm trying to do here. And again, it's the virus virus that is dictating this. And all of us, I think, need to focus on the effort, the most targeted, the most effective ways to actually deal with this. So again, as I said, it's unfair. It's frustrating. It's terrible. But when we get together with other people for whatever reason, it's a real problem, and that's what the virus really likes. If we want to fight this virus, that's what we're going to have to deal with. And it's as uncomfortable as it is. Rachel, do you want to talk a little more about the vaccines?
Yes, sir. I'd be very pleased to talk about the vaccine. So we're very, very hopeful that that the FDA today, actually, and the CDC tomorrow will be authorizing the Pfizer vaccine. And then we anticipate the distribution and then the administration of the vaccines as early as next week. The Pfizer vaccine would be first distributed to hospitals, such as Geisinger Health System and Penn State Health System, where they'll be immunizing their. Then we anticipate potentially in a week or more the Moderna vaccine, the second vaccine, to be authorized by the FDA and the CDC, and then also again distributed to hospitals for administration to healthcare workers. At that time, we also anticipate that the Pfizer vaccine will be also distributed through our pharmacy partners at CVS and Walgreens to nursing homes and other long-term care living facilities through the end of December and then into January. So as you've been saying, there is a light at the end of the tunnel, but it is going to take time as we work to distribute the vaccines through the different phases through the population of Pennsylvania. We, of course, have to take a very careful health equity lens as we look to make sure it's fair for everyone in terms of getting the vaccine.
Thank you, Dr. Levine. Our next reporter is Samantha Zern from PLS. Samantha, you should be able to unmute.
Hi, Governor Wolf. I'm curious whether anything will change with regards to how these measures are enforced, particularly with regards to private gatherings. I know we've heard from y'all before that small private gatherings are spreader events. So, is there anything new to how enforcement's going to happen?
Well, thank you. It's a good question. We've been increasing our enforcement efforts, and we'll continue to do that. We've engaged, obviously, the state police and the Capitol Police and all the other state enforcement officials, but we're also working with local law enforcement. And then you have local health departments. The Department of Agriculture has some regulatory capacity, Department of Revenue, the Department of Labor and Industry. So we're working through all of those to continue to do whatever we can to increase in enforcement. So yes, that's a very important part of this.
Thank you. Next up, we have Ford Turner from the Morning Call. Ford, you can go ahead and unmute. Go ahead, Ford. He may be having a little bit of trouble unmuting, and we can go back to him. So next we'll go to Hannah Brandt from ABC 27. Go ahead, Hannah.
Hi. Yeah. So my first question for Governor Wolf, we know that you tested positive for coronavirus. We've also heard that you've had negative tests as well, but of course you're still quarantining. What does that say about whether or not Pennsylvanians should trust the tests that they're being given?
Well, the hope is that everybody goes through that you test positive, you get the disease, and eventually as you come through it, you test negative, and that's what's happened here. So I tested positive and then have had tests since then and have tested negative. And again, as people go through this disease, I hope that's what happens to everybody.
So your belief is that it's not a false negative, instead that you don't have the coronavirus any longer?
Well, the process is that you actually have a number of tests to confirm that, and I have not yet gotten the results of my latest test, but the hope is that confirms that I am indeed now negative.
And then one more follow-up question, sorry, for Dr. Levine on the vaccines. We've heard that the CDC wants to collect personal information about people and use that data on the vaccines. Is Pennsylvania planning to turn over information from people, personal information for people who are getting the vaccine?
Well, so the CDC has a data agreement process, and so Pennsylvania will be working with the CDC, and we have been able to work through the data agreement. They're not going to be collecting identifiable information, so they're not going to know exactly who a person is or their exact address, but they are gathering demographic information so they can understand who responds to the vaccine best, who might have any particular issues with it. And so, this is not a new process. We work with the CDC all the time on many diseases and pass on non-identifiable data to the CDC.
Great, thank you.
Thanks, Dr. Levine. Next up, we have Paul Go from the Pittsburgh Business Times. Go ahead, Paul.
Hi, thank you for taking my call. I wanted to know, obviously these measures are going to go in effect and there's a lag, so things are going to be worse before they're better, I would assume, given what your projections are for when this could start to see some impact with these mitigation measures, and then also if the situation continues to deteriorate for whatever reason, what additional actions are you contemplating or willing to take?
Well, I'll turn it over to Dr. Levine for the modeling, because we have a number of different models that we're using for this. But at this point, we're not thinking about anything else. So, Rachel, do you want to take the modeling question?
Sure. Thank you. It always takes at least approximately 2 weeks for mitigation measures like this to start to show a decrease, right? Because the incubation period of the virus is up to 2 weeks. So with these current mitigation measures, we're hopeful that we'll start to see an improvement by the end of December. The models that the governor we're talking about, and we follow a number of different models, but one of them that has been used nationally as well is the IHME model, or the Institute of Health and Metric Evaluation. And that's from the University of Washington. And that has been a very, very concerning model. There's a recent update in the last week that shows in terms of the number of new cases, I mean, we're seeing 11 up to 12,000 new cases a day, that by the end of the month, we could be seeing 15,000 up to 20,000 new cases a day. If we're seeing now we're seeing actually over 200 deaths a day, that could be higher. And they anticipate, if nothing was done, that we could be seeing significant amount of deaths by the spring. So that is why the governor is acting now, and why the mitigation measures have to go in place now to work to stop the spread.
Let me just add to that if we do these things and people wear masks and practice social distancing and make responsible individual decisions, the numbers are going to be very much better than the model predicts. If we do these mitigation efforts for 3 weeks and we don't do those, we don't each follow these things are going to be worse. So it's a bit of a moving target, but these 3 weeks, if we all pull together here and do the right thing, we should be able to be in a much better place by the time the vaccines arrive.
Thank you, Governor. Next, we have Flora Pastorera from PennWatch. Flora, you should be able to unmute.
Thank you. Governor, I think there's a little bit of a confusion. On Monday, you said that you were working on a plan to actually help restaurants and said that they were taking a hard hit and they were going to take an even harder hit during the holidays. It seems that your actions today are not going to help the restaurants. They're going to hurt them even further. And some of the restaurant owners have already said that they can't survive and they're going to defy the order and stay open. What will happen to them if they in fact stay open over the next 3 weeks for the indoor dining?
I think what you're talking about is the financial work, and I continue to support. The U.S. Senate is considering what they're calling a compromise that actually includes help for restaurants. But I will look at anything working with the General Assembly that we can do here in the shorter term to make sure that we help those restaurants. Again, as I said, there is no question that restaurants and bars have been really hard hit by this, and we're coming into a really tough time for this mitigation effort to take place, because it really does make a hit into a very busy time for what would otherwise be a busy time. But it's also the kind of thing that the virus really likes. We need to try to stop that virus.
So what will happen if they in fact defy the orders and continue with indoor dining over the next 3 weeks?
Well, we have the enforcement in place. There will be the usual citations and fines.
Thank you, Governor. Next up, we have Jamie Martinez from Spotlight, PA. Jamie, you should be able to unmute.
Hi, thanks for taking my question. Governor Wolf, we've been talking about the fall and winter surge for months now, since the summertime. Why weren't these mitigation efforts put in place sooner and put in place so aggressively sooner?
Yeah, because the surge wasn't as bad. The holiday season, this really, we think, stems from families getting together, the heavy travel that took place over Thanksgiving. And I don't think anybody foresaw that. When you go back to September and even October, it really wasn't as bad as it is now. It has taken off exponentially. The hope was that the things that I did put into place would be enough to take us through the Thanksgiving season. It didn't work out as well as I hoped it would.
Thank you. Oh, go ahead.
If I can follow up on that, what are you going to be looking at to measure success? I mean, I guess what I'm asking is, how will we know that these mitigation efforts are working?
I think that the things that Dr. Levine talked about, the hospitalization rate, we really have to look at that. I think Dr. Rue was the first one to call and say, this is a problem. And as he said in his comments today, it's one thing. The hospitals are doing tremendous work to try to balance their responsibility here. But just, he mentioned all the things that we can't afford to have a healthcare system that's so overwhelmed that it can't deal with heart attacks or accidents. Well, another thing is, we're not even talking about influenza. The flu season really started in October, but it's been pretty mild so far. The worst months for influenza are typically January and February. So we've now gotten to a point where things have really taken off. We've been lucky so far with influenza, but I don't think we can expect to be that lucky for that much longer. And we just can't afford to let things keep going the direction they're going. And since we've gotten into November, things have taken off really exponentially. And as Dr. Levine said, as the models show, if we don't do anything, it's going to get worse even faster. So this is the right time to do it. If we had known more, maybe we would have done it a week earlier, but we need to act as early as we see the need.
Thank you, Governor. Our last question today is going to be from Annie McCormick from 6 ABC. Go ahead and unmute, Annie. I'm asking you to unmute, sorry. It seems to be stuck.
There we go.
Sorry.
We're wishing you that's okay. We're wishing you a speedy recovery from Philly, Governor.
Thank you.
wanted to ask you, we heard Dr. Higa talking about the studies in regards to transmissions. At this point, the restaurant industry has been asking to see the data to justify closing indoor dining, both from Philadelphia's health commissioner and also from the state. What studies, if you are relying on, what studies are they, or what data are you relying on that prove that the transmission rates are high in restaurants and some of the other businesses that are having to close?
Well, I'll ask Dr. Higa to answer this, but there are studies that we're using from Yale, from Stanford, studies from even Chase Manhattan Bank on their credit card use that's happened over the summer. I'm not sure I've seen anything that says anything other than when people get together, take their masks off, drink and eat together, and are in close quarters, that anything good happens when it comes to the virus. That's just the reality. So, Dr. Higa, am I missing something there?
No, I mean, there's a number of different studies that are out there, and I can provide the references that I have here, but that's only, the tip of the iceberg in terms of everything that's out there. So there's a lot of studies that have been done and that are continuing to be done, but the evidence overall is fairly clear, I think.
And my follow-up, sorry.
If I can this evidence goes back for about 6 months or more. So, studies that were looking at the increases that we're seeing, for instance, in the summer in Florida, in Texas, Arizona, California. There are CDC studies and other studies that showed that indoor dining, particularly indoor dining, where, as the governor was saying, you can't eat and drink and actually wear a mask. And as you're talking, people, while you're eating and socializing, especially depending upon the ventilation, the virus spreads. And Dr. Higa had quoted some studies about that. So, I mean, this is something that the White House Task Force highlighted in their weekly reports to states this summer, is that to bend the curve from the increases that we're seeing, particularly in the South and the West, that you had to close restaurants, limit, and then eventually, if necessary, close restaurants and bars and nightclubs. So this is not new information about the impact of restaurants, bars, nightclubs, etc. And it's worse now because it's harder to eat outdoors. And as Dr. Higa mentioned, the cold weather drives people indoors. Respiratory virus like this much more efficiently, unfortunately.
And just a follow-up question, are any of those studies done specifically in Pennsylvania? Do you actually have boots on the ground here of people that are doing the studies in our restaurants?
So I have not seen, I'll ask Dr. Higa, published studies from Pennsylvania, but we know from the contact tracing and the case investigations that were done through Philly, through Allegheny County, and that we had done, that restaurants, bars, nightclubs, etc., were contributing significantly to the spread. It is much harder to get that granular data now, and I've mentioned this before, is that when you're having 10, 11, 12,000 new cases a day, you have to prioritize your case investigations and your contact tracing. And so our prioritizations are primarily to congregate care settings. So that would be nursing homes, other long-term care facilities, corrections, schools, cases involving seniors. We're not able to reach 12,000 patients a day throughout the state. So both the Pennsylvania Department of Health as well as the County Municipal Health Department and our partners there have to prioritize contact tracing. But again, this is not new information about bars and restaurants. It's been known for at least 6 months. Dr. Higa?
Yeah, I think everything that you said is correct. And I would just say that I can't think of any studies that have been done specifically in Pennsylvania, but in the United States, certainly. And I've eaten at a lot of restaurants, and I don't find there to be anything extremely unique about our Pennsylvania restaurants that would make them very much different from any place else.
Thank you.
Thank you, Dr. Higa. Thank you, Governor Wolf. Thank you to Dr. Levine, Dr. DeFlitch, Dr. Rue. We really, really appreciate your time today. We appreciate everyone getting on the call. That is all the time we have for today. So we hope that everyone has a great rest of their day and stay safe and well. Thank you.
Thank you, everybody. Thanks for joining us.